Well, welcome everybody to the Tarrant County Medical Minute. My name is Brian Swift and I'm the CEO of the Tarrant County Medical Society. Today, I'm happy to have Ben Wright. He's the Director of Public Affairs at our TMA. So Ben, welcome to Tarrant County.
Thank you, Brian. Thank you for having me.
So Ben, why don't you tell me a little bit about yourself? How long have you been involved with the TMA? And in specific, how long have you been doing politics?
Sure, absolutely. I've been involved. I joined TMA early in 2022, and so in legislative speak, I've done one session with TMA and going into my second. Before that, I've been in politics. I moved down to Austin to work in the legislature in 2013. I graduated from TCU, and then I went to intern at the Capitol. I worked for a House member, and I got involved with his staff during that session, and I just fell in love. I enjoyed the work, and he was nice enough to take me on and put me on his staff, and so the rest is history. I worked there. I worked in the legislature about 10 years, 5 sessions, but for about the House member and a senator, I worked on committees, political campaigns, and then ended my career in the legislature working for a senator from Fort Worth. Working on a number of regulatory issues and overseeing her legislative package.
Right, Senator Powell.
That's
who
right.
Is a great friend of medicine, and
She's a great human being too.
She is.
Yeah.
She really is. Enjoyed our time with Senator Powell. So let's talk about the TMA Public Affairs team. So, as I understand it, we have a number of people in that particular office that handle particular issues that are important to physicians. So your area of expertise might not be another person's area of expertise. So what issues do you handle at TMA?
Absolutely. So our team, our division of advocacy, we cover a broad range of issues, and so as you mentioned, I work on commercial health insurance and payer issues. Some of that trickles into Medicaid managed care as well. But we split it up. One of my colleagues does public health, and that covers the waterfront from vaccines to public health funding, disease prevention, e-cigarettes. Medical taxes. I have a colleague who works primarily on the budget, and that includes the most of Medicaid. That's Medicaid programs, eligibility, women's health, workforce, GME funding. And then we have another colleague who works on some of our most important issues. She's also our veteran on the team. Michelle Romero works on scope of practice, medical liability, telemedicine, rural health, and the regulation of medicine through the TMB.
Right. So earlier today, you spoke to the second-year students at UNT, and you explained a little bit about them, about priorities, right? How do we, with the thousands of things that physicians have to be concerned about, how do we decide priorities? And why don't you go through that, how you talk to priorities about them?
Sure, absolutely. Of course, we follow our docs and the TMA process. We have developed a lot of policy over the years on a number of issues, but how we prioritize what we're going to work on going into a session, we turn around and we ask our doctors. We work with our council on legislation, who we survey, and we ask for their input to identify what are some of the top issues. We might give them some suggestions on a larger list of what the legislature what we expect to see the legislature addressing and working on. But then we ask them the open-ended question of what do you see as the priority for next session? We work with them, and within those results, we come up with our top 10 list. And we are still working on that for the next legislative session. We're hoping to nail that down at our upcoming Business of Medicine conference, which is October 12th down in San Antonio.
Right. So that's coming up here. And every physician has an opportunity to come down to San Antonio. They want to come down and give input on those priorities as we move into a legislative year. We encourage everybody to go to the TMA website, and you can still sign up for that, correct?
Absolutely.
Great. So I think one thing our listeners would be interested to know is that we know this, but Texas legislature is an every other year legislature. I think in ways that's good, in ways that's bad. But we have a very short window, right, of about 4 months. And can you tell our listeners how many bills do people file in this short window, which is the Texas legislature?
Absolutely, a lot. Last session we saw a high watermark. I think we had something over 11,000 individual pieces of legislation. Those are bills and resolutions combined. About a little more than 2,000 of those impacted medicine in some way or another. And our team tracked those bills,
right?
Which is a lot. You have, again, 140-day session, and you have 181 legislators who can file bills. And we have to track those bills through the process, through 5 standing committees, and try and look to advance the bills that we like that help medicine, and oppose and slow down the bills that have a negative impact on healthcare and medicine.
Yeah, and kill the bills,
yeah.
right? And we
Hopefully.
talk a lot about that in the scope arena.
Right.
Scope of practice, it seems like every session we are talking about a number of bills that want to impede and to go over what people that are not trained to be physicians want to do. So they want to expand their scope. We want to stop the expansion of their scope. And so why don't, again, you talk about some of the scope of practice bills, right? Usually when we talk about scope of practice, we're talking about optometry, right? We're talking about chiropractic, but that doesn't mean we don't work together on some of these things. So why don't you talk about maybe a little, what are the most common sorts of scope bills that you see?
Sure, absolutely. I appreciate it, because scope is something, obviously it's been an issue for TMA for much longer than I've even been alive. It's one of the oldest and most consistent issues in medicine. And one thing I want to take a step back and acknowledge is that we have our TMA priorities, but the legislature has their own priorities.
Right.
One of those is addressing, we do have a real access to healthcare issue, especially in rural and underserved areas. And so they're looking for whatever solutions are on the table, and the expansion of scope of practice is purported to be a solution, and some legislators are receptive to that. What you're seeing gain more traction is what are solutions for rural Texas. That might be independent practice of nurse practitioners. Right now, obviously, they can practice under the supervision of a physician. There are those nurse practitioners and the associations that represent them who want to expand that and remove that supervision and delegated authority. There are psychiatrists who want to be able to prescribe medications without a medical degree. There are pharmacists who they're alleging that a solution to vaccine access and healthcare access in general in rural areas is for them to be able to administer vaccines, but also to test, and once they perform a test or deliver a test to a patient, that they can then follow that up with the treatment. And we call it the test and treat bill. Right. Again, these are things that are being sold to legislators as these are solutions to our rural access issue, where we see that there are serious patient harms that would follow if these bills were to pass.
Right. And we just might have a difference of opinion on how to solve the problem. And one of the ways we did that is through telemedicine, right?
Right.
There's a great opportunity for physicians to check in with their patients through telemedicine. Physicians get paid, so that takes off the table some of the arguments, right, and why broadband is something that's needed in rural America.
Absolutely, telemedicine is a great. I mean, it's one of the good things that came out of the pandemic was just an accelerated adoption and expansion of the use of telemedicine, and really, it's led to the state legislature investing a huge amount of money, I think $8 billion in the last cycle, to the last revenue cycle, to expand broadband access across the state, and with that, telemedicine access as well.
Right. So let's talk about one of the areas I know that you're an expert in, and that is the issue of gold carding. So why don't you talk about what gold carding actually means, right? We're talking about prior authorization. So why don't we talk about where we are, because Texas led and is leading the country when it comes to this issue. A lot of states want to follow the Texas model. So why don't you enlighten us a little bit about gold carding, because I know you're the expert on that.
Sure, happy to. And so gold carding, of course, what we're talking about is the legal framework for an exemption for physicians for medical services for prior authorization. And so, and earning that exemption through high approval rates. In Texas, we passed a law in 2021 that created a pathway where a physician, if you're approved for a prior authorization over a 6-month period at a 90% or higher rate for a given service, then you can be exempt from prior authorization for that service. There's more details than that I can go into if you want, but that was the basic framework of it that passed the legislature overwhelmingly and really gained national attention and popularity. I think 49 other states expressed interest, and I think most of those filed similar legislation in their own states and passed those bills. Congress did the same. Dr. Burgess, Congressman Burgess here in Texas, filed a federal gold carding bill for Medicare Part D. It's even so popular, some of the payers have tried to co-opt the name gold carding and created their own programs, which really I think causes more confusion than good. We'll see how that plays out. But we're proud of our Texas law that we passed in 2021. And however, with that, being the first in the country, we had a big victory. But with that, we were also the first through the door. And I have my boss will use the example of, if you're the first SWAT guy through the door, normally, you're the one who catches the bullets. And I think that happened with us too. We saw some problems with implementation, both with lack of compliance by insurers, but also in a challenging task for the Department of Insurance in writing the first of its kind insurance regulation, gold carding regulations to implement the bill. They took the law that was written and passed, and they had to make that workable, and while also maintaining their working relationship with the insurance industry. And so that created some problems. There were some discrepancies and disagreements over legal interpretations between what we thought the law said in the bill we passed and how TDI interpreted that. There's also just some more practical things like one thing is, I get asked all the time, how well is the gold carding law working? How many gold cards have been given? And we don't know, and nobody knows, because there is no required reporting of exemptions under the gold carding law that have been granted, that have been denied. We have no idea what services are receiving exemptions, what kind of specialties, what areas, or which payers you're seeing more exemptions being granted or not. And so that one piece alone is a huge oversight that we really had hoped that the Department of Insurance would be able to do on their own, but it seems like they might need some more legislative direction to do that. And
that is what we're going to be working on.
Yeah,
you're going to be
absolutely.
spending a lot of time on that this year, is to fix some of those things that we need to get done in order to get better reporting. So we can get those answers to our doctors, because again, we just don't have some of the answers.
Absolutely. We're hoping to have a comprehensive, quote unquote, cleanup bill that will address some of the issues. Both, the reporting is an easier one to explain, but also to address some of the issues of non-compliance, some of the creative loopholes that insurers have exploited in not following the law necessarily.
Right. So we're going to have a busy session, even though we are in every other year legislative body. We all know that we work full time. We're always trying to work with our legislators, build relationships. And so what we need people to understand is that they always have a chance to be involved, to come down with us, and we have something called First Tuesdays. And why don't you talk a little bit about what First Tuesdays is and how our docs get involved in that?
Absolutely. So First Tuesdays is our physician advocacy days at the Capitol. It's named for the schedule, so that it's easy to remember. That it's going to be, other than the first Tuesday of session is in January, and that's the opening day. We don't do it that day, but the first Tuesday of February, March, April are physician advocacy days, where our physicians across the state will come into TMA. We'll spend a whole day at the Capitol. You'll meet the physicians by delegation. We'll meet with their members and their staff to talk about the issues that are important to them. And I really can't say enough about how effective this program is and how much attention and admiration we get from other groups outside of medicine even, that this is one one of the best attended. It's one of the most well organized, even compared to other states. We have our counterparts in other states who have given us a lot of credit in Texas for the First Tuesday program that we have, that they've tried to emulate as well. And a huge part of its success has also been the participation of our Alliance members, because First Tuesdays is a combination of our physicians and the Alliance members, and it's really helped our efforts from back in the early days of tort reform to most recently with gold carding, network advocacy, and just a lot of the successes we have had have been in large part because of our strong physician advocacy.
Right. And one of our Alliance members, Susan Todd, actually was responsible for the creation of First Tuesday, so located right here in Fort Worth. So we're proud of Fort Worth participation. Our physicians, we always have a great turnout. So I encourage every one of our Tarrant County physicians to get a hold of us and learn how you can participate. We set up all the meetings. All they have to do is show up. But I think it's really important, instead of hearing from people like you and I that do politics all day, the legislators really want to hear the stories from the physicians about what they're facing in their offices, correct?
Absolutely. Any group has heard me talk, I'll say, I get paid to do exactly that. I haven't practiced medicine a day in my life, and while we do, our team, we follow the process, we work with these legislators and their staff day in and day out. They, at the end of the day, when they want to hear about the impact of a law, they want to hear from their constituents and the physicians in their district, and the impact that these laws will have on their patients and their practices. And so those are the voices we need to elevate. And we appreciate the county medical societies do a huge work trying to organize First Tuesdays, and that's just such a benefit.
Right. And First Tuesdays is open to all physicians, but also our students and residents.
Absolutely.
And I love when a student comes in and they start talking about scope of practice, especially if they're thinking about family medicine or they're thinking about being an intern. And, if these legislators, again, they want to farm out what they're going to medical school for, the students, get to push back and they say, well, why do you need family docs? Why do you need internists? I mean, why wouldn't I go into specialty? And we all know that we need more family physicians and internists and those general OBGYNs, pediatricians, all those sorts of people, right?
Absolutely.
And so scope of practice, again, is something that we need to pay attention to. So, look, you and I could talk about politics all day. Is there any other thing that you would add before we close? We're going to have you back on during the session, but are there any things that we missed? Any other issues that you would like to talk about real quickly before we end?
Sure. No, I mean, business to medicine, I have to plug that and attend, and we'll talk about some of the things that we'll work on during session, closer to session, and once bill filing starts November 11th, we'll see, we'll start to see what we're working with in terms of issues. My last plug will be to vote in November.
That's right.
Big general election coming up. It most likely won't change the makeup of the either body in the Texas legislature, but it's still important, and at the end of the day, that's what puts our elected officials in office, is voting, and so please.
Right.
November. Yeah.
Absolutely. So thank you for coming today. Like I said, we're going to have you back. And to everybody out there, thanks for joining us for the Tarrant County Medical Minute. And we'll be back next time.